you. Good afternoon, everybody. So I'm kind of going to go through things a little bit differently. I'm not going to be looking at numbers because everybody is a human being and there's so many different factors that are going on in your lives before you step foot in this building. People are thinking about retirement, you're thinking about graduations, life events, all these things that you've been working on for so long. And then a diagnosis comes out of nowhere and now it's like, what's next? What's happening? So I'm an outpatient social worker, so I'm available within the clinic, like the GU unit here. We have inpatient social workers that are here if you're having surgical or some sort of like medical intervention where you're being admitted. We have multifaceted teams that are available within our department to help support people. And that kind of level of support looks different for everybody. Some people, it's questions of advanced care planning. Have you ever sat down and had to think to yourself before of, if I can't make a decision for myself, who am I going to put that on? Because a lot of people, they think it's kind of a scary conversation because you don't want to think about what is the end, who would be the person I trust to put in that place. So having these kind of tough conversations are very important. A lot of people also have a lot of financial concerns, like, you know, some people are not coming from 10 minutes down the road. We've got people coming across the state internationally that are coming here for care. And it's the question of, do I choose to eat today or do I choose to get my cancer care for some people? So it's kind of these tough conversations and getting access to these resources to make sure you have that longevity that you've been wanting for so long. And there's a lot of emotional components too. It's someone just told you you have a diagnosis of cancer. That can be extremely terrifying for people because you didn't know that was coming. That can come with thoughts of fear. You have no idea what's coming on. What is the next step? You have these racing thoughts that you can't control in that moment. So a lot of conversations about how are we going to cope with this diagnosis and move forward are so important. And then a lot of other things like community resources. Do you need a walker because you're declining and you can't stand on your own? Do you need lodging if you're coming from long distances? Where are you going to stay when you're getting your care? It's very important for us to have these conversations. So I wanted to kind of put this in the form of a person. So this is Anna. Anna's a 35-year-old female. She's married with a 10-year-old child. So she's coming from the Orlando area. So she's going to have to come from some distance to get here. So that's going to be that logistical conversation of how are you going to come from Orlando to come to Tampa to get your access to everything you need. And Anna's being told that she's got to have a nephrectomy. She's going to have her kidney removed. So she's going to be potentially recovering from that in 6 weeks. So she's got 6 weeks to plan of what am I going to do next with her family. So this would be where social work comes in and we're very helpful as far as emotional support. Do you need counseling services from yourself? Are you finding yourself in a place where you can't move forward past today because you feel like you are so crippled with your anxiety that you don't know what to do? So a lot of that is conversations about coping with your diagnosis, depression, grief. If you're going through a cancer diagnosis, you can potentially be grieving what you thought was going to be your normal life being potentially taken from you. So a lot of that is facilitating conversations, connecting with other patients your age, people who understand what you're going through, who've walked in these shoes. Within Moffitt, we have virtual support groups that are available for people. So anyone who has a cancer diagnosis to be on a virtual support group with another patient, or for caregivers and family members to talk to other patients and family members to have that connection. The Kidney Cancer Association is a great resource, as well as Emmerman Angel, to kind of get those peer-based connections. And for people who are a parent or a grandparent that is taking care of a child, we do have programs that are available to help assist additionally with that too. Meaning, maybe you have a young child and you have to have the conversation of, hey, I have a diagnosis, and needing to know how to have that conversation at a very age-appropriate level. So we have a program with our Families First within Moffitt where we provide backpacks that are age-based for children. So that has a comfort item and a little information about like books or things of how to bridge that conversation with somebody who's very young and fragile that doesn't understand what they're going through. And we partnered recently with Camp Kesem. It's a summer program that's local for people who have children and they just want to navigate these conversations and meet other parents and guardians. And a big thing that we do is advocacy. So you have this diagnosis, you have this treatment coming up. Maybe you feel like the team isn't hearing you. So sometimes being a part of that conversation, social work can join in with you and help advocate to make sure your voice is heard in a way that you feel like everyone understands where you are coming from and how you want to move forward for the next day. And a lot of that too, with that conversation, like I said, advanced directives are so important, making sure that your autonomy is going to be fulfilled for you. And then with Anna, being 35, if somebody gave you a diagnosis when you're young and you're 35 years old thinking about having additional children, having that moment of, do I need to do fertility preservation to ensure my ability to have children if I have any reduction in eggs or anything like that, to make sure that that is still going to be part of your options. And then care coordination, so kind of seeing how we can be available to assist. So I frequently work with the medical team in a status of the patient is informed that they have cancer. We step in and we are in that conversation of what is next. How are we going to plan out what's going to happen? Do we need to work on the logistics of getting here? Do we need to work on the emotional support? Maybe we need to get you a peer connection because you really feel like you could benefit from it. So it's a lot of interfaceted connections between inpatient, outpatient, and within the community. And then practical support. So transportation. I know it was mentioned earlier, some people are not able to drive for 6 weeks after their surgeries. So making sure that you have that planned ahead of time, because if you are used to driving yourself all the time and someone suddenly says, hey, we can't do that today, that's maybe a conversation that needs to happen to make sure that you are safe. And then financial aid conversations. If your example, Anna, so you're 35 years old and you work and you're part of the sole income for your home, having that conversation of, hey, maybe we need to look into disability, start to do short-term disability applications, and do we need to fill out for any community grants to make sure that we're not concerned about rent, food, or any of the necessities in life so we can try to focus on your cancer care. So overall, kind of connecting with social work, it's kind of assisting in our overall well-being. So it helps with our adherence, making sure we get to Moffitt, we're available, we aren't concerned about, hey, can I make it next Tuesday? Having that conversation to make sure we're able to be here. And then we're here for very complex conversations. Sometimes, unfortunately, that is, we're having surgery, or maybe we have to think, is this the right choice for you? What is your goal? And if it's anything for end of life, making sure that everybody is with their comfort.